So, tennis elbow, what we're looking at your clinical presentation is lateral elbow pain and pain with gripping tasks. About 40% of people will get this in their lifetime, and it can be quite a debilitating pathology. So generally we tend to see recovery in most people in 12 weeks, at least 12 months. However, there's a small amount of people who will continue to get issues lasting longer than 12 months. So self-management is really important with tennis elbow. A couple of tips for it. Try and lift with your palm facing up. That way it takes some of the pressure off of the tendons coming along the outside of your elbow. Other things then is to avoid aggravating activity. So generally this is forceful gripping, pushing and pulling, particularly in your end of range where that tendon's under greater tension. So trying to lift closer to your body, push and pull with a flexed arm. Progression on then from our retraining of our wrist extensors will be to put it under resistance. So what we're going to start with is a light band, just holding for 8 seconds, seeing is there pain with that. Once we're able to hold for 8, we can relax off, assist back into that isometric position, holding for 8 seconds again. So what we're aiming for is to work higher reps. So we want to build strength endurance. So we're going for 15 repetitions by 2 sets, and we're just trying this once daily. Once we can hold for 8 seconds, what we'll look to do is put a bit more endurance through. So we're going to assist into wrist extension, remembering that a bent elbow position has less pressure on that tendon and is a bit more tolerable in terms of pain. So we're looking to hold this for a full minute. So that time under tension is important. Making sure our pain doesn't go above 2 out of 10. Once we can tolerate our isometrics, we're looking to add in some really gentle pronation and supination. In the early stage, if we're quite irritable, just going small distances in the pain-free range, and then we can start increasing the weight. We can also do this without the elbow supported. A progression can be to come into more elbow extension. But we want to keep in mind we're keeping this in under 2 out of 10 pain. Okay, our next progression then will be to work through a concentric eccentric phase. So we're getting a 1 second hold at each end of range and making sure that we're working into this wrist extension. Once again, we're aiming for strength endurance. So we're going to go for 3 sets of 15 with about a 90-second rest in between sets again. How we can progress this is we can start working more into elbow extension. However, this will be later on in your rehab program. It's important to remember that it must be gradually progressed and as pain tolerates as well, so under that 2 out of 10 pain. Elbow is the full kinetic chain is also important. So if I have issues in my shoulder, that can cause overcompensation down in the elbow as well. So it's important to incorporate some shoulder setting work as well. An easy way to do this is in a press up push position. Same again, I'm in a bent elbow position, which is more tolerable for that tennis elbow. I'm dropping my chest through and rounding out as much as possible. So I'm really trying to get those scapular stabilizers and my serratus anterior working. Same again, aiming to go for sets of 15 or 15 repetitions by 3 sets.